want to talk about is CBD oil for chronic pain. And so CBD oil is a lot of things when it comes to chronic pain. Number one, and most importantly, it's non-addictive. So there are no endocannabinoid receptors in the brainstem. And so it can't become addictive. And we talked about last week, they've given doses of up to 700 milligrams to healthy individuals, and it was not toxic, which is hugely important when we're talking about all these opioid-related deaths. And here we have a natural product that we can give people, and they can relieve their pain and oftentimes relieve the condition, which we'll talk more about in upcoming weeks. But oftentimes people take CBD oil for pain, and then they realize their cancers go away, their symptoms resolve, and then they can cut the CBD oil dosages way down and just kind of take a maintenance dose, more of a wellness dose, as opposed to a ongoing treatment dose. And so we see all these clinical outcomes, and we see all these benefits, but the way that the CBD oil works is through the cannabinoid system. And the endocannabinoid system has receptors in the brain, in the white blood cells, and the ones in the brain actually directly mediate pain. And it's the only system that we have that directly mediates pain. All of our other drugs that we give is just an anesthetic. It just lowers our sensory system to a point where, like I say, we anesthetize our respiratory rate, our heart rate, and other vital functions, and we succumb to that and we die. And so CBD oil actually eliminates the transmission of the nerve fibers going back to the brain of sending the signal of pain so you don't feel the pain. And then, like I say, because so much pain is related to inflammation, we have these cannabinoid receptors on our white blood cells, and that actually mitigates inflammation. Now, I could talk all night about inflammation, and this is a whole other condition. They call it chronic low-grade inflammation, and you can Google that on PubMed or look at it in the literature, and it is just rampant. Tons of articles about chronic low-grade inflammation. And if you look at all of our chronic degenerative diseases, it all starts with some form of inflammation. Heart attacks and strokes, cancers, autoimmune diseases, our degenerative conditions of arthritis, all of these things start with low-grade inflammation and then lead to worse conditions. Our dementia and Alzheimer's and Parkinson's, it all starts with inflammation, and it has an inflammatory component. So CBD oil, through the CB2 receptors on the white blood cells, actually lowers and eliminates a good portion of the inflammation in your body. So not only are we not feeling the pain, which is important to have a lifestyle, but we also don't want to damage our bodies because we don't feel the pain. Pain is a signal that something is wrong. So now we're without the pain. We actually want to do something that allows our body to heal and repair, and CBD oil does that. So it's a 1-2 punch for your body. It helps lower that inflammation, and when you lower the inflammation, it allows the body to heal and repair. The inflammation kind of keeps things stirred up to where you can't heal and repair.